Jardiance, Invokana, Farxiga, and Steglatro are all examples of SGLT2 inhibitor medications. They're all basically the same drug. They do the same thing in your body, but they have different brand names. They all come in pill form, so they are pills that you take every day. These drugs were intended for type 2 diabetes, but more and more people with type 1 diabetes are also taking them. SGLT2 inhibitors, whew, that's a mouthful, work by filtering out some of the glucose in your bloodstream through your urine. When your blood sugar is high, your kidneys are already filtering out a little bit of that extra glucose, but SGLT2 inhibitors tell your kidneys to filter out even more. So these medications are really good at helping your body know when there's too much sugar in your bloodstream. These medications tell your kidneys to take that extra sugar and filter it out through your urine. This means you are peeing out that extra glucose, that extra sugar. So your blood sugar comes down. Fortunately, these medications don't want your blood sugar too low, so they do stop filtering out sugar at a certain point. When your blood sugar is down at 120, it stops telling your kidneys to filter out more sugar. The benefits of Invokana, Jardiance, and Farxiga is that it can help lower your A1C and your overall blood sugar levels. Many people also report losing some weight on these medications. That's because it's preventing all this extra glucose from being stored as body fat. Instead, you're peeing it out, so your body doesn't have to deal with it. These medications can also help lower your insulin needs if you take insulin. SGLT2 inhibitors can be used in combination with GLP-1 medications like Ozempic or GLP-1 medications like Mounjaro. On their own, these medications do not cause hypoglycemia. If you take insulin and you start taking an SGLT2 inhibitor, you could have low blood sugar. That means you need to talk to your doctor about adjusting your insulin doses. Don't wait to talk to your doctor because low blood sugars are dangerous and too much insulin can be very dangerous. While the side effects of SGLT2 inhibitors aren't really that bad, you still need to be really aware of them. The biggest side effect of any of these medications is that it makes you very thirsty. You're peeing more because your body is passing that extra glucose out. So you have to drink a lot of water or you will get severely dehydrated, which can lead to headaches, dizziness, and even kidney failure. Acute kidney failure is caused by acute dehydration. You've got to drink a lot of water every day. Drinking enough water is really important. And some people may find that they have to pee many times a day, much more than usual. That can be frustrating. How do you know if you're drinking enough water? Your pee should be generally very light yellow or ideally clear. If you're taking any of these medications and your pee is dark yellow or even brown, that means you are severely dehydrated. You need to definitely drink up, but also potentially call your doctor. Another side effect to be aware of, especially if you're a woman, is yeast infections. If your kidneys are filtering out all that extra sugar through your urine, sugar feeds the growth of yeast. So that excess sugar in your urine, yeah, it's a good thing your body's getting rid of it, but it could trigger the growth of yeast and cause recurring yeast infections, which could be pretty annoying. For the same reason, urinary tract infections are also a potential side effect while taking any of these medications. And it's just that excess sugar feeding the growth of bacteria. There are also some unexpected benefits of these medications. Research has found that SGLT2 inhibitors protect your kidneys and your heart health. If you are already living with kidney disease, your doctor might prescribe these medications to help further protect and preserve your kidney function. Even if you don't have kidney disease as a person with diabetes, these medications have shown in research to protect your kidney function. If you're living with congestive heart failure or you've had cardiovascular issues in the past, your cardiologist might prescribe these medications because they've found that these medications help preserve and protect the function of your heart. SGLT2 inhibitors can be very helpful for people with type 2 and even type 1 diabetes. But you've got to make sure you're drinking enough water. Drink up. Thanks for watching Diabetes Nerd. Find my books on Amazon.